Hi, welcome to the Contra Costa County Elder Care Channel. My name is Stephanie. I'm the Marketing Director for Horizon Elder Law, as well as today's host for the Contra Costa County Elder Care Channel. Today we're here talking with Kathleen Fitterer. She's a nurse practitioner with Palliative Care of the East Bay. We're here to learn more about Palliative Care of the East Bay and how you got involved with this organization. So, can you give us a little bit of background about yourself and how you got involved with Palliative Care of the East Bay?
Sure. I've been a nurse practitioner for 13 years now, and a little bit more recently came to work with the organization Hospice of the East Bay and Palliative Care of the East Bay. Palliative Care of the East Bay is a program that has been in place for a little over a year now, and provides in-home care for remediations of symptoms as well as to help people with some social issues around care when they have a chronic disease.
While the concept of palliative care may not be new, it seems to be a more prevalent option for patients now than in the past. Can you tell us specifically what palliative care is?
Sure. There's a lot of questions about palliative care out there. And you're right, it has been around for years and years. It's a concept that we love. It's this idea that as people are going through either an acute illness that might have a treatment that really causes a lot of side effects and needs the patient might need help with those side effects, or if they have a long-term chronic illness that causes them to need a little bit of help, whether that's with bills, with funding, with symptoms that they're trying to manage in the home to try and decrease the number of doctor visits. So you bring in a palliative care team so that those people can be helped in their home with symptoms, with issues of finance, and just with overall global support.
That's great. So who's eligible for palliative care?
Anybody who needs it. So a person that might be considered eligible for palliative care is somebody who has a long-term illness that they're continuing to have interest in treating.
Mm-hmm.
But we all know that as you have an illness for a longer period of time, that it can cause an increased burden of side effects. And so sometimes it makes it more difficult to get out to the doctor's office. Sometimes it makes it more side effects that we do need to manage. And that might be nausea, it might be anxiety, it might be pain. And these things we can treat in the home and then work with their physicians, whatever specialty or primary care physician, to help maintain that person's independence in the home.
Well, that's great. So most recently there's been some media attention addressing the importance of adults giving consideration to the type and extent of medical treatment they would want, especially for those who experience an unexpected tragedy and become unable to verbalize their medical wishes. Since this topic isn't always brought up until it's too late, can your palliative care team help with these discussions?
Of course we can. We're very experienced with how to manage these kind of conversations, and in hopefully a light manner so that it's not so burdensome. I think time slips by for most of us and we're so busy that we just think we always have a lot of time to make those decisions. And there's a little bit of fear about facing our own mortality. And so sometimes if we can just get those conversations in, have them done, everybody feels lighter and more relieved that they've actually made those decisions, and everybody in the family is now aware of it. The healthcare team is aware of what their goals of care are. And then they can relax and continue to enjoy life and be busy.
I understand that Palliative Care of the East Bay's program includes a physician coming in person to the patient's home to initiate palliative care or wherever they call home. Can you describe the roles of the other team members?
Sure, I'd be happy to. So we do have a physician who comes into the home, and currently she is doing the initial visits and helping to set up the plan of care. She's usually accompanied by an RN, and the RN helps actually initiate the plan and start collecting the details of what's needed and what needs to change and what medications they're on, and starts helping coordinate that care with the primary care physicians. We also have a social worker, and the social worker, some people really appreciate the fact that there's a social worker in place because there's maybe family issues that they're concerned about. Maybe there's issues of insurance that they're concerned about, or durable power of attorney that they want to understand better and get into place. And so sometimes a social worker they've never had access to, so the social worker comes in and is able to really straighten out some issues and give them an enormous peace of mind. And then we also have our admin assistant, who is a vital part of our team. She will be the voice that you hear on the phone when you call, and she helps to coordinate all of us in the field.
So I know Medicare is giving some consideration to palliative care benefits. Currently, what is the cost of your program?
Our current cost for our program is $200 a month. We get a lot of support from our board, so that really does help put the program through. And that $200 a month helps to pay for the ancillary services of social workers, our admin people, as well as our RN that comes in the home and helps to coordinate care.
Well, that seems very reasonable to me. Is there a time limit for the amount of time spent on palliative care for each month?
Really, the client determines that. We've had people come and go on palliative care where they had issues. They come on board and we straighten out their issues. They're doing better. Their symptoms are controlled. Their finance issues are taken care of, and they graduate from palliative care until they need us the next time. And then they know we're here and waiting for them, which is a wonderful thing. And then we have other people who just love, or their families love, the security of knowing that we have somebody coming in at least monthly to check on that individual and keep our eyes on them. And that provides an enormous amount of reassurance to family members as well as the client.
It certainly sounds like Palliative Care of the East Bay is offering care and support for those patients with serious illness whose quality of life may be improved as a result of the care provided by your team. Is there anything else you'd like to add about your program?
If you have any questions about the program, I encourage you to give us a call, or maybe a palliative care team that's closer to your home in your area. There's so many wonderful services that palliative care can do to improve the overall quality of life of an individual. So that would be a wonderful thing.
And I too would second that. Well, thank you so much for your time today, Kathleen. If your loved one would like more information about Palliative Care of the East Bay, you can find all their contact information on their main page on the Elder Care channel, including a link to their website, or you can call Palliative Care of the East Bay at 925-852-0010. Thank you for watching, and we hope you have a wonderful day.